Hi, my name is Adolph Lombardi. I'm an orthopedic surgeon practicing here in the greater Columbus community. The name of my practice is JIS Orthopedics. I'd like to talk to you today about knee arthritis. There are basically two types of arthritis, the osteoarthritis and the inflammatory arthritis. We're not seeing much more of the inflammatory arthritis as we did when I first started. That has a lot to do with the tremendous medications that have been developed to take care of rheumatoid arthritis, psoriatic arthritis, etc. So let's focus this conversation on osteoarthritis. There seems to be more patients afflicted with osteoarthritis of the knee than the hip. It's about 70% versus 40% in my practice. And I would tell you this, that there's a couple different ways that the disease presents. You can either develop what we call varus malalignment. What is varus malalignment? Your leg is bowing outward, or you can develop valgus malalignment, where your knee is bowing inward. So knock-knee versus outward direction are the kind of deformity that you'll see. The basis of this disease is osteoarthritis, a wear and tear phenomena. There is some multifactorial genetic component to it, but pretty much it's a wear and tear phenomena. Now, typically what I see is more varus malalignment, that outward bowing, than I see the inward bowing. And I also see quite a bit of what we call anteromedial osteoarthritis. So what's this? This is the patient who comes in and has medial inner side of the knee disease, okay? In the knee, there are three compartments: the inside part, the outside part, the kneecap. And not always are all three compartments involved. Many times it's a single compartment. There can be isolated inner disease, medial disease, isolated outer disease, lateral disease, or isolated patellofemoral disease. And I look at the knee as three compartments and will offer you a solution based on what I see. I do quite a number of these medial or inner partial knee replacements. About 30% of the patients I see have the anteromedial osteoarthritis, and we do a partial knee. So why do I think that's better? Well, if I retain your ACL, your PCL, the outside part of your knee, your kneecap, I've retained all this normal tissue. So obviously, intuitively, that knee is going to feel more normal than if I took it all away and gave you a total knee. So your next question is, well, what about the outside of the knee? Am I going to develop arthritis there? Well, I'm going to answer the question. I hope you live long enough for that, because this device is going to give you probably 15 years of service. It's going to feel more normal. Your range of motion is going to be better. If you come to me with 120 degrees a range of motion and just inner side pain, I know that I can restore you back to your normal alignment by replacing that cushion on the medial side, inner side of your knee, and give you a knee that functions a lot more normal than a total knee. I'm not saying a total knee is a bad operation, because there are times when all three compartments are involved, or at least two of those three compartments are involved, and you'll need a total knee. Replacing the kneecap area is another great operation. That way you don't violate the ACL, the PCL, anything between the femur bone and the tibia, the leg bone. You leave all that normal tissue behind. You leave the meniscus, those cartilages in your knee, and you just replace the worn out kneecap and the anterior, the front part of the knee. The best one of these partial knees is the lateral side. Not as many that we see, but those patients are so happy when you replace that and get that knee again lined up normally. Now let me talk about a total knee, because you might say you've been bashing the total knee, but I'm saying I'm not. I'm just saying that go to a surgeon who's a selective surgeon, who picks the right operation for you. Total knees are a great operation. I've been doing them for 37 years. They've evolved considerably. Materials are better. Plastic is better that we use. Designs are better and improved. And if you have a knee that is really stiff, you've lost range of motion, you're bowing quite a bit, either in or out, you're most likely going to need a full knee replacement. We can restore you to natural limb alignment. We can give you back that motion that you require, that bend, that you can ascend and descend stairs better, get out of the car better. It is simply a great operation to treat that osteoarthritis that you're having. And many times you'll come to us, you've had a surgery where they removed a cartilage, either on the inside or outside, or maybe you had an ACL reconstruction, or maybe even had, unfortunately, a fracture and reconstruction with hardware. And we can work around all of that and restore you back to a good situation. I can't tell you how many patients come back after a well-done knee replacement and tell me, thanks, Dr. Lombardi, you've given me a new lease on life. So if you have a knee problem and it's related to end-stage disease, osteoarthritis, inflammatory arthritis, come see me at JIS Orthopedics.